Hello, everyone. Welcome to Open Up and See. We appreciate you taking time out of your busy schedule to join us for this webinar. My name is Eden Ivy. I'm a dental hygienist and a public health dental hygiene provider. I am the Director of Client Success for Mouthwatch. This webinar is presented by Mouthwatch Learning. We have some exciting news. In the coming year, Mouthwatch Learning will be providing CE for their webinars, so keep an eye out for notifications about our upcoming webinars so that you can earn some free CE. Our goals for this course are to describe why intraoral cameras are a vital tool in daily practice. We're going to discuss the benefits of intraoral imaging and of high definition imaging. And then we're going to take time to demonstrate some camera techniques and tips to help you get really comfortable with taking high quality intraoral images. Intraoral cameras have become very common in daily practice, and we are going to talk about why that's important and how we can utilize those cameras. So let's start by talking about why we need intraoral cameras, why we should be implementing this into our patient care, why we should take time out of our limited time with our patients to take intraoral images. So I'm going to get really cliche here. A picture is worth 1,000 words. We've all heard that before, and it 100% applies to intraoral images. When we are describing clinical conditions using words alone, we are limited. Intraoral images allow us to share information with our patients, with other providers, and with insurance companies clearly and objectively. This chart is from an article that discusses using intraoral cameras to increase patient compliance. And the article talks about using intraoral cameras for two main purposes. One is for diagnosis, which is what is shown in this chart, and the other is for improving patient compliance. So in this chart, we see that intraoral cameras can be used to diagnose conditions of the teeth, teeth-related, and soft tissue conditions, and that they can be used both directly and indirectly. Now, when we say directly, that means you have your patient in the chair and the intraoral camera in their mouth. Indirectly is where a provider who is not directly with the patient is using those images to provide a diagnosis. Now, this chart is showing the different ways that you can use an intraoral camera to increase patient compliance, both in demonstrating need for treatment and demonstrating proper home care. Okay. So the first documented before and after images of a dental procedure happened in 1848. So the idea of intraoral imaging is not new. Our first intraoral camera came onto the market in 1987. It was $40,000. It was massive. It's usually on a rolling cart. It had a dedicated computer with a handpiece and a video processor box, and floppy disks and VCRs were used to view the images. Fast forward to today, and thankfully our intraoral imaging technology has come a long way. Most cameras can be purchased for between $300 and $5,000. We have high resolution images. These cameras fully integrate with our imaging and practice management software. They're plug and play, and they are lightweight and portable. So when we're choosing a camera, there are a lot of things that we want to watch out for. There are a lot of options on the market. And so when we are researching cameras and deciding what we want to purchase for our office, we want to make sure that the camera we choose provides clear images, that it has a high resolution, and we'll need to choose between fixed focus or autofocus. Now, the difference between fixed focus and autofocus that autofocus, it chooses an object and then the camera automatically focuses on that focal point. So this is what you see on your phone. When you're taking a picture, you'll see it picks an object and it kind of goes in and out of focus until it zeroes in on that specific object. Fixed focus is always in focus as long as you are in range. Our Mouthwatch cameras, both our standard camera and our Mouthwatch Plus camera, are fixed focus. This allows for easy capture of clear images. As long as you are within range, which is about 3 millimeters to 40 millimeters, and you aren't moving, you're going to get a clear image. We want to make sure that our camera has a good light source. We want to make sure that it has seamless integration with our imaging software. We want it to be plug and play, ready to go. We need to pay attention to the length of the cord. We need to make sure that we have enough room to work around our operatory. Now, there are options for USB extension cords that will increase the length of that cord if you don't have enough length. We want to make sure our cameras are easy to use. Cameras on the market range in complexity, and generally speaking, the more complex the camera, the more difficult it is going to be to use. And when we talk about ease of use, we want to make sure there's an ergonomic design, that it fits well in our hand, that it has a single click capture, that we just have to click one button to get that image, and that the buttons are easy to reach. Now, we know we need an intraoral camera. We know what to look for in an intraoral camera. So when should we be using this intraoral camera? Hygiene visits, I like to use them at every hygiene visit. We want to use these cameras for OHI and for progress pictures, and really anything that's flagged for the dentist to review. So personally, I like to snap a picture of anything that I'm going to bring to my dentist's attention. And then as I'm waiting for my exam, I can go through those images with my patient so that they understand what I'm looking at, why I'm concerned. And then when the doctor comes in, he can either confirm or he can say, no, that's not really an issue. We don't need to worry about that right now. But then the patient is already open and ready to accept that treatment. They've already heard it from me, they've seen it, and then they hear it from the dentist. Pictures instead of words. As dental professionals, we speak a different language. We have words for clinical conditions that the majority of the population don't understand. They don't understand the words and they don't know what the clinical conditions are. And so the more we can use pictures instead of words, the more effective we're going to be in our communication. Soft tissue lesions. We'll talk a little bit more about this, but documenting and tracking soft tissue lesions, intraoral cameras are critical. Teledentistry. If we are working with a provider who's in a different location, those images are the eyes of that remote provider. So we have to be using intraoral images and getting clear diagnostic images. Case and treatment presentations. We'll talk more about this, but we are showing our patients what we see. We are making them a partner in treatment. And insurance claims. Again, we'll talk about this one a little bit more as well. But before and after pictures are a fantastic tool in making sure that your claims are paid. Okay, so we already talked about this. As dental professionals, we speak a different language. I can tell my patient, I see inflammation, your tissue is boggy. I have all of these words for conditions that my patient is not going to understand. We have a very clear image. When I hear the word inflammation, gingival inflammation, I know exactly what that means. My patient does not. If I show them a picture of red, boggy, bleeding tissue, they're going to understand this is not healthy and this is what I need to do to improve my health. It also helps them take responsibility and ownership for their own health because they can see it. It's there, and they connect with it emotionally. All right, now I love these images. Jamie actually took these images, and when we have one without the other, we don't see a full picture, but when we're able to put that X-ray next to an intraoral image, we're really able to see the full picture, well, share the full picture with our patient. So in the intraoral image, I can show the patient the buildup I can show them what's going on, the areas that they need to clean, how they need to focus, their interproximal cleaning, they're brushing along the gum line. In the X-ray, I can show the destruction that's happening because of that buildup. So it's really effective and impactful to be able to use both of these images side by side. Here we have a similar situation. I can show my patient the buildup, what it looks like, what they need to keep that at bay and keep this tissue healthy. And I can also then show them in the X-ray the destruction that's happening because of this buildup. All right, in case presentation. Again, I'm going to go back to that. We speak a different language. I can look at this image, right? And as a clinician, I can say, okay, there's an old amalgam, there's ditching along the margins, I see a fracture, I see creage lines, I see some shadowing. I can say all of those things to my patient and they have no idea what I'm talking about. I'll tell them, this is a high risk for a fracture. This could fracture below the gum line and you might lose the tooth. They hear all of these words, they might agree to treatment, they might not. But if I show them this picture, it's very clear, it's very easy to understand that if I bite on a half popcorn kernel, I could lose this entire cusp. My patient doesn't know what ditching means, but they can see that there's a gap right here between this old filling and their tooth. Okay, in the past, X-rays were one of our only tools in case presentation to help a patient just understand why they needed the treatment that they need. This is a great image. You can see as clinicians, we can see there's definitely an issue with this restoration, right? But when we show that intraoral image, there's no question. Our patient can really understand the breakdown, the destruction, and what their restorative needs are. All right, so let's talk a little bit more about documentation and soft tissue lesions. So when we document a soft tissue lesion, we see it in a patient's mouth, we need to document size, color, location, duration, all of the things. No matter how clear I am in my description, the interpretation of that description can always be subjective. When I have an image, it is an objective documentation, especially if I'm using a probe or a measurement device in that image. So we can really track, have there been changes? With intraoral images and soft tissue lesions, it's also a great way for referral to connect directly with an oral pathologist or an oral surgeon to see, does that patient need to get in tomorrow for a biopsy? Or is it okay for us to just watch this for a little while? And with our high definition camera, we'll talk about this in a minute, getting that true color clarity is so critical with our documentation of soft tissue lesions. I have a couple more soft tissue lesions here, lateral border of the tongue there. Okay, so Mouthwatch this year is introducing the Mouthwatch Plus camera, which is a high definition camera. Our standard camera is fantastic. It's great for everyday use, but we wanted to introduce this high definition camera because there are certain instances where a high def camera is really going to give you the images that you need in certain situations. So let's talk about what high definition means. Now, for a camera to be considered high def, it needs to be 1080p. The P stands for progressive scanning, which updates the full frame images more quickly than traditional interlaced images. So a true HD camera, such as the Mouthwatch Plus camera, will deliver a 1080p image, which will capture 1,152,000 more pixels than a 720p image. A lot of the cameras on the market right now that say they are high def are only 720p. So a 1080p over a 720p will result in an increase of more than 50% in resolution. And higher resolution means more pixels per square inch, which means more pixel information, a higher quality image, a sharper image, and also an image that you can blow up on a full screen and you're not going to lose any resolution. It's going to stay clear, it's going to stay sharp, it's not going to be pixelated. So another crucial factor in the rate at which intraoral is the rate that intraoral images are transmitted to the computer monitor. So this is especially important if you're taking video. Anything lower than 30 frames per second is going to cause your images to appear jerky. It's not going to be a smooth flowing image. 60 frames per second is necessary for that smoothest video display. And the Mouthwatch Plus camera is both 1080p and 60 frames per second. So that's when you get these beautiful, clear, crisp images. And like I mentioned before, you're able to blow these images up to your large, 30-inch monitor during treatment presentation and keep that clear, crisp image. Here's another one. You can see these craze lines, these cracks. You have this beautiful high resolution. You can see these craze lines on these anterior teeth. So the benefits of the Mouthwatch Plus camera, we're going to have a true 1080p, high resolution, sharper images, and anatomically correct color. So we're going to get a very true color rendition, which is going to be critical in documenting soft tissue lesions and also gingival health, being able to show what that soft tissue looks like, being able to track progress in health. All right, so now we're going to talk about taking high quality images. The majority of us were not taught how to take intraoral images in school. Schools are now starting to introduce this into curriculum, which is fantastic, but there is a whole workforce that was not taught this in school. So first of all, you need to know your camera, and you need to know your camera before you have a patient in your chair. You need to have a plan, you need to prep your patient, and you need to prep the teeth. And you need to stabilize. This is the number one most important thing in taking good images is stabilization. All right, so knowing your camera, you need to make sure that your software is installed. Most cameras will have a software or a driver, a small piece of software that needs to be installed so that the camera can connect to your imaging software. If you're new in an office and you don't have the original paperwork for your camera, you can find user guides online. If you have a Mouthwatch camera and you need to install button capture software or look at any instructions, you can go to mouthwatch.com to our support page. We have all of this documented, and most intraoral cameras on the market are also going to have their documentation online. You want to make sure your camera is integrated with your imaging software. Again, these instructions are at mouthwatch.com. You can get integrated. There's instructions for any imaging software out there. We've got instructions for it. Right. Do you know how to access the intraoral camera through your imaging software? And in Dexis, you have to click the little intraoral camera button and go in. Each software is different, so you need to make sure that you know how to do that ahead of time. And make sure you know what all of your buttons do. You don't want to think you're capturing an image and turn off your camera. All right, we also want to have a plan. This is a template for a full mouth series of intraoral images. Now, you're probably not going to be doing a full mouth series on every single patient. You might be doing it on a new patient, but you still want to have a plan and a sequence of how you take your images. Most imaging software does not have templates. We don't have templates for intraoral images like we do for x-rays. And so you need to know the sequence that you're taking your images in so that when they pop up, you know which teeth are which. All right, this is a full series maxillary arch. So this is what that full series looks like, where we have a buccal, occlusal, and lingual. Actually, we don't have facials on these anteriors, but we have linguals and then buccal, occlusal, lingual, on the left side. These types of series are great for teledentistry or new patients when you're documenting, you want a baseline for your patient's mouth. And you need to come up with a sequence for additional images. You won't just be taking pictures of teeth, you'll be taking pictures of soft tissue as well. You might be documenting the bite or the occlusion, the vestibules, the tonsillar pillars, hard and soft palate, floor of the mouth, lips, tongue. Okay, and then we want to think about positioning. Now, I like to take images in this position where my patient is mostly upright and I'm standing up, very similar to taking x-rays. My patient is comfortable, I'm comfortable, I can move around and get the images that I need. So we want to think about our patient's comfort, provider's comfort, access to the screen. You need to be able to see your screen and ensure that you're taking good images. And you need to make sure that your cord is long enough. There are USB extension cords. If your cord is too short and you feel restricted, you can add that extension that will give you the length that you need so that you can access, you can move comfortably around your patient. You can play around with different grasps here. You might be using a palm grasp, you might use a pen grasp, you might use a combination. And then most importantly, we need to fulcrum. We are going to use intraoral fulcrums, extraoral fulcrums. We're going to get creative and remember that there is no wrong way to fulcrum when you're taking intraoral images. And we're going to go through some techniques to stabilize. So, and then of course, when we're getting ready to take those images, we want to prep the patient and prep the teeth. So we're going to tell our patient what we're doing and why we're doing it and how we're going to do it. And then we're going to dry the teeth. Now you can dry with air if you want. You can just swipe those teeth with a 2x2 or have them bite down on a 2x2. If your patient has excessive saliva in their mouth, you are going to get reflection. You're going to get bubbles that are going to occlude the structures in the mouth. So it is really important to try and get that mouth dry. You can even just ask your patient to swallow, to suck air through their teeth. If you just have them do one of these, even that will get enough of the saliva out of the way. So there's different methods and different techniques. You just have to find what works best for you and best for your patients. Okay. This first technique, stabilizing the camera on the opposite arch. This only works if your camera has a plastic casing like a Mouthwatch camera. If your camera is metal, you don't want to be resting it on the opposite arch. That's going to be uncomfortable for your patients. This is a really easy way to stabilize the camera and get nice images, especially occlusal images, or if you're getting, the roof of the mouth or linguals. Two-handed grasp. Don't be afraid to get creative with your grips on your camera. I really like to hold my camera in two hands and also use that second hand to fulcrum extraorally on my patient. Actually, I'm going to stand up. I have my Typodont here, and I can demo some of these techniques while we look at these images. Sometimes it's helpful to see it in real life here. Okay, got my guy here. All right, so I'm going to go this way with the two-handed. So what I really like to do, I like to get as many points of contact on my patient as I can. And then I come in with my camera and I can either grab this with my thumb, I can balance on my hand. Let me show you a picture of what that looks like. So this right here, I had a hygiene instructor tell me, she calls this shooting pool. So I'm stabilizing my hand extraorally on my patient, and then I am shooting pool with my camera, and I can move easily around my patient's mouth. I can be smooth and quick and very, very stable. And then I can just turn my camera over. I can do the same to get my mandibular images. Okay. All right, support with thumb. This is another one, like I like to retract with my finger, and then I can fulcrum on my thumb. I can rest that. It's a little bit of a modification of the shooting pool. I can rest this camera on my thumb. Okay. When I teach this class in person, we do a hands-on section, and I go through all of these mobilization techniques, and then I have people attend my class, and they come into practice, and they have the camera in one hand, and they come in like this. This is natural. This is what we think we should do. We come in. You are not going to be able to get a clear image because the second you push that button, your hand is going to move. So you really need that stabilization so that you can push that button without moving your camera. Okay. You want to use your camera to retract, especially when you're taking images on the buckle. You just insert your camera, have your patient close down a little bit, just like you would with your mirror, and retract that cheek. I just said mirror, and it made me think of a tip that has really helped me take much better images. Now, as dental providers, we use indirect vision all day long. We're staring in a mirror. We worked really hard in school to be able to get good at indirect vision. Cameras are direct vision. So if you get in the mouth and you are having a really hard time getting the tooth you are trying to get in the image, tell your brain, this is direct vision, not indirect vision. It's a little mental trick, but it made a huge difference for me. Okay, this is another technique that I learned from a dental hygiene instructor, and it's a two-handed grasp, but you are behind your patient. You're at 12 o'clock. So you come in, your patient is sitting up, you're behind your patient, you come in two-handed. Let's see if we can get a better view here. And you come around and you're very stable and you move very quickly through the mouth. You just snap your images, you flip your camera over, and you come right back through to do the mandibular. This is a very, very nice, smooth, quick way to take a series of images. This is also my favorite way to take images of the lateral border of the tongue. That's a tricky spot to take an image, and that's a lot of times where we see lesions. So what I like to do is I stand behind my patient, have my camera in a kind of in a modified pen grasp, palm grasp here. I have my 2x2, grab my patient's tongue, pull it to the side, and then I come in and I have nice strength because I'm in a nice stable position. My arm is tucked in by my side. I can retract that cheek. I'm pulling the tongue to the side. I'm very stable, and I can get that image of the lateral border of the tongue, which could be a really tricky one to get. Okay, so in this picture, you'll see that the camera is balanced on the lower arch, and we are taking images of the upper arch. This is a great technique if you're taking a full arch, or if you have a patient that you don't feel comfortable putting the camera in the occlusal plane. If you're afraid they're going to bite it, maybe they have limited opening, maybe they're a little kid, maybe they are differently abled, and you're worried that they're going to bite down on that camera and hurt themselves. So we're going to balance that camera. I like to, grab their chin with my hand, and I can rest on my thumb. I can guide that camera with my thumb. When I tilt this up, I can get that full arch. If I angle one way or the other, I can get a quadrant or a sextant if I need to get the occlusals, and I don't ever have to put that camera into the occlusal plane. Okay, This is a great tip that will help you, again, with smaller children or people with limited opening. Now, this camera, she's dropped it down into the buccal vestibule to take that occlusal image. So what that looks like, I'm going to come in. So if I'm resting on the lower arch, trying to take images of the occlusals of the maxillary molars, and my patient can't open, I can't get far enough away from that tooth to get a good image, I'm just going to drop this camera down into the buccal vestibule, and I can point it up and I will get an image that looks like this one right here. Now, the cool thing about this, I can use it, I can drop it down into the buccal of the right side to take images of the right maxillary molars, or I can tilt this toward the left side. I can get the lingual of the maxillary left molars or the occlusals, again, without ever having to go into the occlusal plane. So with limited opening or patients that I'm afraid are going to bite the camera, I can stay out of that occlusal plane, but still get those lingual and occlusal images. Okay, we're going to be, sometimes our intraoral camera is not going to be intraoral. We're going to be extraoral, taking pictures of a bite or of an occlusion. We can move around, we can get the front of the mouth, we can go into the side, we can retract the cheek to get that occlusion. And this, again, this is that same technique. This is a smaller patient, so you can see how she's really dropped down into that vestibule to be able to get that occlusal image. Here she is retracting. We're retracting with that camera and really having that patient close down so that we have space to get far enough away from the tooth to get a nice clear image. Okay, so that's it for my camera techniques. The last thing I want to cover, and we'll just cover this quickly, we're just about finished, is taking care of your camera. If you are not taking good care of your camera, it is not going to continue to perform and you're not going to get good images. So you want to use the barrier that was designed for your camera. If you have a Mouthwatch camera, you want to be using OptiClear sleeves. They're going to give you great clarity. They're going to protect your camera. They'll protect the lens. They are a nice tight fit, so they're not going to move around while you're taking images. You want to review the cleaning instructions specifically for your camera. If you have a different camera, definitely don't want to be using corrosive disinfectants. Avoid Cavicide. You want to use isopropyl alcohol, so either an alcohol wipe or just straight alcohol on a 2x2, and really try to avoid wiping down the lens if you can. You want to store your camera in a secure place. If you have a mount, that's a great idea. It's going to keep it safe. It's going to keep it from falling on the floor. Maybe you want to keep it in a drawer. I have definitely been guilty of walking by and catching my foot on a cord and pulling down an X-ray sensor. Please don't tell my dentist. But you don't want that to happen to your camera. So just pay attention. A holder is a great idea. Wall mount, desk mount, or stored safely in a drawer. When you are implementing intraoral cameras into your office, whether you're new to intraoral cameras or whether you want to increase utilization, there's a couple of things that will help increase that utilization and help your team be successful with intraoral imaging. It is ideal to have a camera in every operatory, especially in your hygiene operatories. If your team is having to get up from their patient care to go and get the camera, they are less likely to use it. You want it to be a part of patient care for every patient, and so you want it to be within arm's reach. You're going to make sure your entire team is trained. You don't want to just have one assistant in the office that knows how to use the camera, and so anytime somebody needs imaging, they have to go find that one assistant. You want everybody to know how to use the camera. You want that software installed on every computer in every operatory so that you can take images quickly and easily. You want to integrate imaging into routine visits, like we talked about with hygiene visits, before and after images. Make this a part of your routine and share these images with your patients. Your patients will appreciate it and they will come to expect it, which then provides accountability, and your team will be more likely to take those images. Right? Intraoral imaging brings value for providers and for patients. It really creates trust between patients and providers. It helps create urgency for treatment and reinforce the need for treatment. And most importantly, like was put in the chat at the beginning of the presentation, intraoral imaging allows our patients to see what you see. All right, so that's it for the presentation. It looks like there are some questions in Q&A. I'm going to stop sharing my screen and I will let Jamie go ahead and moderate questions.
Absolutely, Eden. We've had some good questions, some good comments. And if you have questions for Eden, throw them in the Q&A or the chat. One question we have is, how is the quality of extraoral images with the high definition camera?
Okay, so the high definition camera, so the Mouthwatch Plus camera is fixed focus, just like the regular Mouthwatch camera. And so you're going to get the clearest images from about 3 to 4 millimeters up to about 45 millimeters. So you're going to get the highest quality intraorally. If you come out, like if you're trying to take a full face shot, you are going to lose some of that clarity because you will be out of range. You really need to be in that range to get the highest definition and the sharpest images.
Wonderful. How long should you expect an intraoral camera to last?
I think a lot of that depends on care. Mouthwatch turned 10 this year, and we have people who are using some of our first cameras. We have a 30-day money-back guarantee and a 1-year warranty, so definitely that 1 year. But with proper care, they can last for several years.
Absolutely. I know practices that have them 7, 8 years and still going strong. So they do last. Another question was, when we're thinking about capturing images on children, how easy is it to capture? Is it a fairly quick capture with the Mouthwatch camera, and why?
Yes. So I use teledentistry in early Head Start classrooms. So I am taking images on 2, 3, and 4-year-olds, which it's a little bit of a learning curve. But with Mouthwatch, because of the fixed focus, as long as you're stable and in range, you're going to get a clear image, and it's a single capture. It's a click. You might have to take a couple images to get exactly what you're looking for, but their Mouthwatch cameras are great on kids. It's easy to capture those images, and it is quick.
Yeah, I found the same thing. It's always a moving target with children, especially young ones.
Yes.
Is there a limit to the number of images I can capture?
No. And there won't be a limit, but the way that the image is stored, that is going to be dependent on your imaging software. That's not so much camera dependent. That is going to be your imaging software.
Another comment is, I want to use an intraoral camera for field use in developing countries using a laptop, not in the operatory. What software should I use, and are there free software options?
Yes, there is a free software option that is already on your computer if you have a Windows 10 computer. If you go down into the Start menu and you search for Camera app and pull that up, you can use the Camera app on your Windows computer. It will integrate perfectly with the Mouthwatch camera, and you will be able to capture images without purchasing any software. David, we maybe should talk about Teledent. And teledentistry software for you. Jamie can definitely answer some questions for you about that, but that might be a very good option for you.
Absolutely. And I'll just mention too, David, that I have been working with some international programs that are going to refugee camps, providing care. And they're doing exactly that. They're using teledentistry software in addition to our cameras and providing some absolutely phenomenal care and screenings to those residents. Does Mouthwatch integrate with Open Dental software?
Yes, absolutely. We have yet to find an imaging software that the Mouthwatch camera does not integrate with. It integrates with everything. You can go to our website. We have a comprehensive list of all of the softwares that we integrate with. If yours happen to have a software that's not on that list, if you call our support team, we can get you taken care of. But yes, Open Dental, we do integrate with.
And I think that answered someone else's question, wondering if it'll work with their existing software. So yes, with everything we found so far. Do they need to be calibrated or any updates that need to take place over time for the cameras?
So not for the camera itself. For Mouthwatch, we have button capture software, and that updates automatically. With the Plus camera, we have a new button capture software that you'll download when you get your Mouthwatch Plus camera, but that will work for both the Plus camera and our standard camera.
Wonderful. And David, you're very welcome. He noted that we did donate a camera for his use in the Pacific Islands. So we love to support things like that when we can. Another question, Eden, is do your hands get tired using it?
Me personally, I have not experienced any fatigue using the Mouthwatch camera. It is so lightweight. I know this isn't really demonstrating how light it is, but it is so light and it is very ergonomic. It feels great in my hand. And generally when I'm taking intraoral images, I'm not taking images for more than, 3 or 4 minutes is max. It's very quick that I'm taking these images, but it is very lightweight and I do not personally experience any hand fatigue.
Another thing that I've heard you say before, Eden, is new patients, you often recommend, and you do take a full set of intraoral images. How long does that take you?
It depends on the patient, but I can usually get through it in under 5 minutes.
I agree. And because time is always a factor when we're in an appointment. I know in some instances, I've seen it and I've done it personally in practice under about 90 seconds, being able to just go and capture in those sections.
Yes. Yes. And especially if I'm only capturing, if I'm not doing that buccal-occlusal lingual on every single surface, it's under a minute. It's very, very quick. Yeah.
Can you turn the LEDs on and off? I like to use transillumination.
Yes, that's wonderful. So with our standard Mouthwatch camera, the LEDs are always on. That's not an option. But with the Plus camera, we have a light button that allows you to adjust the intensity of the LEDs, and one of the options is off. So with the Mouthwatch Plus camera, you can turn those LEDs off.
Wonderful. And you mentioned this before, but where can I find out if my dental software is compatible with the camera?
Okay. If you go to mouthwatch.com and click the support tab, there you'll see the camera option and it will give you a full list of software. Like I said, we have not found an imaging software that we cannot integrate with. So if you don't see your software on that list, contact our support team and they should be able to get you set up.
Wonderful. Okay, good question and story time. What is the funniest story you've had using intraoral cameras with patients or dentists? Unique experiences here.
Oh my gosh, I feel like I needed some prep for this one, Jamie. You go first.
One of the things that I found is I have to tell my patients that we're going to take the images and I will show you after. I have seen more patients flip from their back to their front, trying to see what we're doing and trying to see what I'm looking at. And I had an older lady who did just that. Just suddenly her front was on the chair and wanted to know all of it and wanted me to take pictures like that so she could see it as we were doing it.
Yes. Yeah, that's much funnier with grown-ups, but little kids are the same way. So when I'm doing my setup, I do try to make it so either they can see the screen without moving, or they can't see it at all, because they will do all of this to try and be able to see those images. They're excited to see those images. So yeah. Yep.
Absolutely. All the fun stories we have in dentistry. Another question, is it possible to connect the camera directly to a smartphone?
Not an iPhone. It is possible to connect it to Android. The button capture software does not work with Android, though. So you would be able to connect it, but you wouldn't be able to take images with the button. We've done some testing, and we haven't been able to get that software to work on Android yet.
So I will ask you to kind of wrap up.
Okay.
What is the best tip or best advice you can give somebody who's not currently feeling comfortable using an intraoral camera?
So, like with any new tool, practice and using it, there's going to be a learning curve, and you're going to get better, and it's going to get easier. If you can set up some time, some low pressure, no pressure time, like maybe you and another team member practice on each other, where you can practice taking those images, practice these different techniques we talked about in a low pressure situation where you don't have a patient in the chair. I think that's going to be the best bet to really increase your comfort level with taking intraoral images.
And I've even practiced on myself from time to time, just to get the feel and the movement of the camera if I didn't have somebody else to practice on.
Yes, that's a great tip. Yeah, if you have time in between patients, practice taking pictures on yourself. Practice on a typodont if you have one, especially if you have one that has cheeks like mine. That's, just the more practice, the more comfortable you get with it. It's like any of our instruments. The more time it's in our hands, the more comfortable we are with it.
Yeah, the more comfortable and the more efficient. Absolutely. Yeah. It becomes that extension. I've used it extensively too in my patient education and case acceptance, because as you mentioned, we can try to explain to them what we see, but when we put them side by side, as you've seen in some of the images and some of the slides, it takes the selling out of it. You don't have to feel like you're such a salesman when you're doing it. Eden, I want to thank you for presenting for us as well. And if anybody has questions, they can reach out to me at jamie@mouthwatch.com, or they can reach out to Eden directly, eden@mouthwatch.com, and we'll be happy to connect. Again, Eden, thank you. And thank you everybody for spending your evening with us, and have a wonderful night.
Hi, welcome to the Mouthwatch intraoral training. If you've noticed, the Mouthwatch intraoral camera is installed in every operatory for convenience purposes. The next step of our training is to train the staff who will be using the camera. That includes dentists, hygienists, assistants. We want the staff to use this with confidence. The third aspect of the training is to introduce it to the patient. This is not about some high technology gimmick. It's about empowering the patient to get involved in their oral care to lead to better patient outcomes. When do we capture intraoral images? There are 5 instances. To capture a tooth shade before preparation to have a record of the color. Oral pathology. Going forward, there to be no oral pathology referrals generated without a picture of the lesion for our records. If we're not going to refer out for an oral pathology and we chose to monitor the lesion or inflammatory condition, then we would take a picture of it, use a periodontal probe as a reference guide, and when the patient returns 6 months later for the recare exam, we will then follow up and make a comparison. Education. As an oral hygiene adjunct, take an image of plaque buildup, for example, on the linguals of lower molars. Then we could use that image to show the patient where they need to focus their oral hygiene efforts to remove the buildup. We plan to expand the usage of these cameras for every dental exam and hygiene visits before and after. Why do we want to capture oral images? I mentioned education. Education is critical for better patient outcomes. And we could use an oral image without using complicated dental terminology, which could often confuse the patient and embarrass the patient and hinder them from asking appropriate questions. For example, a picture of swollen, inflamed, bleeding gums. That image says it all. There's no need for further explanation. Accountability. We need to empower the patient so they can be more accountable for their oral outcomes. For example, food impaction. Take a picture of a food impaction under a 3-knit bridge and show the patient where this food is and how to remove the food. Therefore, the ball is their court when it comes to their oral hygiene, which they have to do daily. Builder of trust for patient and providers alike. This is very important. It's not a sales pitch, but this will allow the patients to jump on treatments that are not necessarily embraced by patients, like scaling root planing. For example, a picture of a periodontal probe that disappears in a periodontal pocket. This will educate the patient and hopefully they realize why they need this very important treatment. In conclusion, intraoral cameras will integrate very well with our existing workflow. They will not disrupt it. Taking pictures will help patients visualize aspects of their oral care. Hopefully the pictures will empower the patients and lead to better communication, more confidence, more accountability, and better patient outcomes. This is how we take images in Ascend. We select the imaging icon. We go to the imaging tab, acquire images. Then we select the device that we're looking for, which in this case is 2D facial oral images. You'll see the Mouthwatch icon, and then you select Proceed with Acquisition. The camera will light up at that point. You're going to get the image that you want to capture. For the first image, you need to press the capture button on the computer. Subsequent images, you can press the white button on the camera itself. And image number 3. Once you're done with the images, you press the scan button. You close out of the screen. And then if there is an image you don't want to take, you don't want to be uploaded, you will uncheck it here. Then you're going to assign the images. Begin uploading, and the images will go into Ascend. Now we're going to demonstrate how to use the intraoral camera on a patient. First and foremost, and most important, is proper PPE at all times. Please forgive me, I'm not using a mask for this demonstration. In addition, speaking of PPE, you'll need to insert the camera into a barrier sleeve. Doing it this way, making sure that the logo and the blue bar is inserted in this manner. Here is where practice makes perfect. You need to experiment on your own to see which is comfortable for each patient. Each patient is slightly different. For example, before we begin, the teeth need to be dried with a 2x2 gauze. And there's a few different techniques I will show you. There's the cross arch thumb fulcrum technique. It's important to have a solid resting point. Here I am resting the camera on my thumb, taking a picture of the opposing arch. So my thumb on the lower arch is taking a picture of the occlusal surfaces of the upper teeth. Another example is the retract cheek method. I retract the cheek to take pictures of the buccal surfaces of the teeth that I'm taking a picture of. Finally, there's the 12 o'clock technique or position where I insert the camera intraorally gently this way, and I'm able to take a picture of the palatal tissues.